Hello, it's Corey here from the First Aid Training Co-operative, and today we're going to give you a video demonstration of how we would do child CPR, cardiopulmonary resuscitation. So we've got a mannequin on the floor which we're going to use for our demonstration, and I'm going to be the first aider who comes across a non-breathing child. So I come into the room, there's a collapse, there's a casualty lying on the ground. So the first thing I'm going to do is stop and assess for danger. Trying to find out any history. Why is this child lying on the floor? What's happened? Is it safe? I'm also going to be thinking about putting gloves on if I have them. I'm unlikely to have gloves in many urban contexts, but I'm certainly looking for any signs of cross-contamination. I'm going to approach to check to see if the child is alert. Hello, my name's Corey. I'm a first aider. Can you hear me? Are you all right? Can you hear me? Open your eyes. Can you feel this? Come on, wake up for me. Wake up. There's no response. So I'm going to shout for help. Help! Is anyone there? Can I have some help? We're now going to open the airway. So a head tilt, open the mouth, lift the chin. That's the airway open. I'm now going to check for B breathing. 2, 3, 4, 5, 6, 7, 8, 9, 10. I've got a non-breathing child. So the first thing I need to do is to give the child 5 rescue breaths. In order to do that, I need to tilt the head back, I need to lift their chin, and I need to pinch their nose. I'm going to put my mouth over their mouth. Now look for a chest rise. 2, 3, 4, 5 breaths. And then I'm going to start 30 compressions. I may well be able to do one-hand compressions if it's a small child, and I'm aiming to compress the chest by 1/3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Now 2 breaths. And continuous 30 compressions, 3, 4. If I get tired, I can join my hands together and do 2-handed compressions if I get tired. So remember, we're compressing the chest at a rate of 100 to 120 beats per minute and a depth of 1/3 of the chest volume. So far we've done 5 rescue breaths, 30 compressions, 2 rescue breaths, 30 compressions, 2 rescue breaths, and this is my final set of 30 compressions. As no help has arrived, I'm going to call the emergency services after this set of compressions. So if the child hasn't shown signs of circulation, come round, started breathing, I'm going to use my phone and call the emergency services. I need to dial 999, ask for an ambulance, I need to tell them where I'm at and tell them what's happened. So I've got an unresponsive, non-breathing child and I need help as soon as possible. Once I've done that, I can put my phone down and I'm going to continue with my CPR by going straight back to 30 compressions and 2 breaths. And we will continuously repeat 30 compressions to 2 breaths for this child until help arrives. So just to summarise then, for child CPR, as soon as we realise that the child is non-breathing, we need to give them 5 rescue breaths followed by 30 compressions, 2 more rescue breaths, 30 compressions, 2 breaths, 30 compressions. So really that's 5 rescue breaths and a minute of CPR. If that hasn't brought the child round so they start breathing, we need to call emergency services, which we need to dial 999, get help on its way, and continue with our CPR sequence, 30 compressions to 2 breaths until help arrives. And with the child, we need to be compressing the chest by 1/3 of the size of the chest.